Hi guys, my name is Mercedes Martinez. I am a registered nurse here in the state of California for the last 17 years. I've worked for El Centro Regional Medical Center for almost 18 years now. I started my education at Imperial Valley College and concurrently attended online courses at Cuyamaca College. The reason I did this is so that I could complete my general education courses sooner than expected. I did 2 years general studies for Imperial Valley College. That allowed me to obtain my associate's degree, and another 2 years into the nursing program. Prior to the last year of completing the nursing program, I started working at the hospital as a certified nurse assistant. After you've been in the nursing program for at least 1 semester, it automatically gives you the nursing assistant certification so that you can work if you need to be. So I didn't have a necessity, but I did have want the experience. So I did that, and it was good because you get to learn if it's something that you really want to do. So after I passed my test for licensure, I started working at El Centro Regional Medical Center. And while I was learning new areas of nursing at El Centro Regional Medical Center, I also was studying at SDSU. I took maybe a semester off, but then I started taking classes again so that I can continue my education and receive my bachelor's in the science of nursing. I also received my public health nurse certificate from SDSU as well. So during that time, and this is all during the time of me going to school and working full time, I learned to work in the NICU, the nursery, pediatrics, mother-baby, labor and delivery. I did pre-op, I did post-op, recovery, and sometimes I would get in there and help the moms that were laboring as well. So that was a lot to take in, but you can do it. You can, maybe sometimes you're not too sure what you want to do, but as long as you're willing to put yourselves out there, there's a lot that you can accomplish. After I did all of that, I became the charge nurse for those departments, and then I also started working at Pioneers in the pediatric department. I enjoyed it, but after some time I said, why am I working so much? And as you guys get older and learn more, those are things that you're gonna have to learn to set limits for yourself. I had a family and I was going to school continuously. So at some point you have to say, this is what's right for me. Nobody can make those decisions for you. But when that time comes, I trust that you guys will be strong enough to make those decisions for yourself. As for me, I continued working, and then I became the interim director for the maternal child department. So maternal being everything mom, and child being everything baby and pediatrics. After about 10 years there, I decided that, okay, I think it's time to move on and also continue my education. So I started school at St. Joseph's College of Maine online. East Coast schools are cheaper than West Coast schools, so that's just something for you guys to consider if finance is something that you guys are worried about. When you're looking at schools, you want to look at grants and different opportunities. If you can apply for scholarships, always do so. So I received scholarships and all that good stuff for all the way up to my bachelor, so I didn't pay for any of that. My work paid for it. Grants, financial aid, anything that I could pay for, have paid, I did. So I encourage you guys to do that. There is absolutely no excuse to why you can't do something. You just have to dedicate the time to actually want to do it. Okay. I most recently completed my master's in business administration, and that's helped me in the work that I'm doing now because it's not at the bedside. I'm still a nurse. I still need to be a nurse to do what it is that I do, but I oversee patients telephonically and work with the managed care plans to help patients in the community receive the services that they need, just so that they can know how to better help themselves. So on a daily basis, I'm coming in. I have a team of people that I'm responsible for, and I help them to coordinate care services for the patients, talk to doctors, come up with plans on how they can best meet those goals. So if you have diabetes and your goal is to have a normal blood sugar range, then we say, okay, so what are some of the changes that we can work on together so that we can make them better for yourself, so that you can feel better and you can feel that we're improving your health. So we do all those little tasks, eating right, checking blood sugar, things like that. And so this is something that's so desperately needed in our community, and not just in our community, but all over the United States, that health plans have started paying for nurses like myself and community health workers to provide these services to these patients. So as you guys get older and you are in your careers, you're going to see and notice changes in healthcare and whatever profession that you decide to be a part of, that you're just kind of like, wow, this is really necessary. But it is, because our dynamic changes, our populations change, a lot of things change. So you have to be willing and able to be diverse, flexible, and change, which is why I've changed so much in the different jobs that I've had. Okay, I'm getting a little off topic, so let me come back. I'm trying to answer the questions that were emailed to me, so let me see. I've discussed some of my work history. We've gone over my education, and let's see, a moment that impacted your life. Well, okay. So when I was about a freshman, right before I went into high school, my stepdad, who was like my dad, was killed for who knows why. He was out. He went to go pick up an appliance with his friends, and he didn't come back. It was ruled a homicide, and my family really suffered because of it. He was the primary breadwinner in the house, and financial struggles were very real. Looking back, I think that if I would have changed anything, it would have been to have a more open mind, be a bit more responsible to what was going on in the home, and probably ask for help. I know in our culture, sometimes we're told, you know, what happens in your home stays in your home. You don't discuss those things. But sometimes when we talk, others are able to help us. So from what I learned from that experience is that you never know what somebody is going through, but you might be that person that's able to help. And sometimes you don't think that you're helping much, but just listening to somebody is helping. Maybe you don't have advice to give them, but just being able to listen so that they can get the words out and they can start their healing process is a big help. So I also learned that I didn't like to financially struggle. So I wanted a career where I felt like as much as I moved around, I could feel financially independent. Nursing, anything medical, is definitely a way in that, which she's receiving that, okay? One of the other things that impacted my life was my senior year. I have a cousin who at the time was 2 years older than me. She was pregnant and she gave birth. It was an emergency, and within 24 hours she passed away. She went into a coma and she never woke up. I looked at that and I thought, that's something that I never wanted somebody else to go through. So I said, how can I make that difference? And so when I decided to go into nursing, it's probably one of the biggest reasons why I went into mother baby. It gave me a sense of purpose that I was educating others and learning as much as possible to prevent those type of scenarios from happening again. Let's see what else. there's going to be things that you don't think make a big difference in your thinking, your thought process, but they're going to drive the decisions that you make. And whether you decide to acknowledge them in that moment or in the future, I hope that you guys choose to make a positive impact, because it will make a difference, not only for you, but for everybody around you. Let's see. So I'm trying to read through the questions that I haven't answered. Why did I choose the career that I chose? Well, I think as an effect of those two circumstances, it kind of pushed me to wanting to do something more. I also have always had a mind for business, so coming into a more administrative role of nursing has allowed me to kind of merge those two parts of my mindset together and being able to do productive work. That's the thing that nobody tells you when you guys are your age. You can be more than one thing. You can be an artist and you can be a professional in the classroom, or you can be that nurse that likes to go and be in a rock band on the weekend. I can tell you there's a lot of doctors here who have their own band and they go and play at different places, and you can be many things and you can be many of those things all at once. You don't have to limit yourself. What are the licenses and certificates that I have? Well, I'm a registered nurse. That is through the state of California. Every registered nurse, you can look up on the BRN, Board of Registered Nursing website. Depending on the state, you go to that state's website, you can look up their name, and you will look up if their license is active, and everybody has to be listed on there. So anybody medical has to be registered through a board. Let's see, I'm also a public health nurse. So what that says is that because of my education and experience, I also have the capacity to be able to take community surveys and do things to help not just the people in front of me, but at a community level. Okay, I'm also a mental well-being first aid expert, I guess you can say. It's additional education that we've had to take in order to be able to help our patients. Sometimes we ignore our mental health and we need assistance from others. So that additional education allows me to provide that assistance. I'm also a CITI clinical research certificate. So what that means is that I've taken the competency for clinical research, which means I know the do's and the don'ts and can participate in anything clinical research. So when we have new studies, people who are enrolled, they have to be enrolled a certain way. When we collect data, it has to be done a certain way. Surveys have to be taken a certain way, and that just says, yep, I'm certified to be able to do that. I also am certified in advanced cardiac life support. That's like CPR, but with additional medications. CPR is also another one. PALS, which is also an advanced CPR, but for pediatrics. NRP, neonatal resuscitation, that's for babies when they're just born, anything under 30 days. I used to be an instructor for that as well, because you don't treat everybody the same. So you have to be educated in order to be able to say, yes, I can proficiently help you. Okay. I'm also a freedom from smoking facilitator, which means people who want to quit smoking, I can help guide them and facilitate them in being able to successfully quit. Lactation specialist, that's for mommies who are breastfeeding, and sometimes people need help with that, and so I'm certified to be able to help you. I also have a competency for English and Spanish translation. There's going to be many populations that you come across, and you need to be able to effectively communicate with everyone. And if you can't communicate with them, you need to be able to allocate those resources to how you can communicate with them. My Spanish has improved immensely since I have moved to the Imperial Valley. Let's see, cultural competency, moving from cultural competency to cultural humility. So as we're moving forward into our diverse populations, it's about understanding one another. Doesn't mean that you have to agree with them. It doesn't mean that you have to live the same lifestyle. It just means that you have to have an open mind and remember that they're human too. And even though some people can minimize what you're saying, it doesn't mean that it isn't valid. Everybody deserves to have the validation in what it is that they are saying and experiencing. So these additional trainings and certificate, because my teams have them as well, means that any type of patient that we get, we are able to competently display that respect to their culture, to their religious practices, to their lifestyle practices, and not say, hey, you're wrong. No, because there's a reason why everybody does what they do. And so we're able to validate their concerns and help them to improve what it is that they'd like to improve. Okay? Motivational interviewing. So I'm also certified in that. Why is that important? So what motivational interviewing means is that I'm able to talk to a patient and get them to open up. Sometimes when we're in a conversation with somebody and you kind of just want to give the yes/no answers, those are called open and closed questions. And you just want to give the yes or no answers and be done with the conversation. But the way that I'm engaging with you, the way that I give you information, the examples that I give you help you feel comfortable enough so that you can truthfully answer the questions that I'm asking. And sometimes it's just in such a casual conversation that you don't even realize that I'm asking the question. Okay? And then we have ASAM training, which is additional training for mental health. Expert training. Expert training means that I am certified to ask questions about alcohol or drug dependency, any type of substance that you may need assistance with, or if you are not ready to give up those substances, just education to let you know that when you are, there are services available. Okay. I'm also certified in integrated health care for providers. So this means that I can talk to the doctors, I can talk to the nurse practitioners, and I can be the in-between from them and the patient and say, this is what they're communicating to you, and say, this is what your doctor wants to know. Because sometimes when we get more education, we're so used to talking to each other in certain key words that, we don't realize that, hey, not everybody is aware of what those words are. Not everybody is aware of your key terms. So it's learning to be able to communicate effectively. Let's see. I think I've answered all of your guys' questions. I hope that you guys are having fun in your class and that you've gotten to know about yourselves and that you are exploring the opportunities that are available to you in medical fields or other careers as well. I want to let you know that medical field doesn't always mean at the bedside. We have a whole team of system analysts. We have teams of information technologies, information's in laboratory sciences. There's all kinds of things, and whatever you guys choose to do, I wish you so much of the best, and that you guys get to live extremely passionate, fulfilling lives. What you guys do now, remember, is practice for your future and the people that you want to be. So continue practicing who you want to be, continue practicing the best versions of yourselves. And remember, if you guys ever need any advice, I'm sure Miss G will continue to be there for you guys. I hope that this was enough, but if it wasn't, let me know. Bye, guys.